So Australian post-graduation, first of all, Australian post-graduation, what do you mean by that? See, the confusion that comes with most of the doctors, like most are from the India, Bangladesh, Pakistan, Sri Lanka. So most of these countries has the exam, FCPS, MD, these are the exams. I mean, if you go to India, that's MD. In Pakistan, Bangladesh, FCPS, these are the exam. MD also available actually. Apart from that, diploma available, all these type of countries actually. Even in Sri Lanka is also available, kind of similar actually. Now, the thing that is coming, I mean, they usually think in that way that, okay, I'm finishing the MBBS and I'll just apply for a, exam and I'll just get the chance. Actually, the things are always not like that in Australia. You first of all need to fulfill the criteria. So I'm going to talk you about a fellowship exam, especially for the GP, which, believe me, most of the centers in Australia I went, or many I know in person, and also many doctors also know me nowadays. And so sometimes I go visit them, meet them. When I told them I want to meet them, they're like, most welcome, come. So someday I'll try to bring one of the doctor, and the degree which I'm talking about is FRACGP, first of all. So in FRACGP exam, it's a fellowship exam for the GP. All right. So it's a fellowship exam for the GP. So what are the additional thing you need for the FRACGP? Now you have to do, you have to pass the AMC, and then only you can apply for the FRACGP. By the way, FRACGP again is of 3 parts. So what are those 3 parts? First, it goes with the AKT. Secondly, KFP. So AKT is related to MCQ. KFP is related to MCQ and the written. And lastly, there is a OSCE exam. So this constitutes the FRACGP. All the doctor's chambers, have you guys noticed, those of you in Australia, when you go to doctor's chamber, those are the good GP, they have written the MBBS and they have written the FRACGP. Have you noticed something like that? I hope so you do. All right, so these are the FRACGP, which is a fellowship exam for the GP and which is very, very popular. As I said, it's a little different in Australia. Now, what is the criteria? The criteria, you need 4 years of experience. So how many years? 4 years. So in this 4 year, 1 year, it has to be inside Australia at least. Okay. So example, you have 4 year, say you have 6 years of experience in your country. Then what do you think? Do you need any further experience in Australia to appear in this exam? And say still yes. Doesn't matter. You have your 3 year will be counted from your country, and apart from that, 1 year inside Australia. Now, for example, some of you are fresh graduate. You might have only 1 year of experience. In your country. What you can do? So all you can do is, after the MC1, you get a job in Australia. You work in Australia for another 3 years. Then you can apply for FRACGP. Everyone clear with this question? Concept which I just told. Everyone clear with this concept which I just now told? So total 4 years of experience. 3 years it can be home country. 1 year it has to be in Australia. If you do your total, all the experience in Australia, that's also okay. But mandatory, it is 1 year has to be in Australia. That's the thing. All right. So, and this 4 years of experience has to be within last 10 years. Like now someone is having huge experience somewhere like 10 years back. Now that won't be counted. So within last 10 years, total 4 years of experience, and 1 year must has to be working inside Australia as a supervised GP, full-time, not part-time, as a GP, full-time supervised. So those of you are basically coming in Australia as a GP, for them FRACGP is more easier because those have already more experience in their own country. It's more easy for them to get into the FRACGP. So what usually they do, I'll give you experience. I'll give you an idea with one of the doctor I know. So that doctor is also my student actually. So, she passed MC1, then got a job offer, then cleared the pesky. So start working as GP after that went for FRACGP exam, now preparing for the FRACGP AKT and cleared the AKT already. Okay, so her upcoming exams are KFP and the final OSCE. When she will be also passing these two exams, she will be done with the full FRACGP. All right, and she will be a super GP that time. And of course, she will be earning a lot. Now already they earn a lot, but of course, when you have fellowship degree, they'll be earning a lot. Yeah. Now, a few of the more information which I want to tell. I mean, these are the things which I want to add here. If you guys have any question, you can ask, feel free to ask. But as I mentioned, I'll try to bring one doctor who already passed the FRACGP. I mean, that will be good for all of you guys.